noticed this yesterday, and it's the perfect setup to our next guest this morning, a Mohawk traditional drummer singing out for healing during this COVID-19 pandemic. Posted that on Facebook and has been asking for other Indigenous voices to join in, to sing songs of hope and, as I said, of healing. People from First Nations across the country joined her online with video tributes. People from First Nations across the country are going to be joining in online to something else. A town hall, an online virtual town hall today to take a look at how coronavirus is specifically affecting Canada's Indigenous peoples. It's going to be led by the First Nations Health Managers Association, and the CEO is Marion Crowe, who is with me this morning. Delighted to reach her in Ottawa and to meet her. Welcome, Marion, to our program today.
Thanks, Heather. I appreciate the time.
From the sounds of this, you're going to have major participation, 500 people, the estimated number, taking part in this town hall, this online virtual town hall. Can you tell me exactly what you're going to be discussing, what you're going to be doing with this afternoon?
Absolutely, Heather. We are going to be hosting a virtual online town hall today at 1 p.m. Eastern Central Time. We're going to be hosting that from unceded Algonquin territory to all of our participants across Canada. It's targeted directly to our health directors, health professionals at our front lines in communities who are working directly with COVID-19.
So you'll be taking calls from people from First Nations health managers as they have questions for you about how this is affecting Canada's First Nations. What are you expecting are going to be their top priorities and concerns?
Well, we have Dr. Valerie Gideon from Indigenous Services Canada. She's a senior ADM. And Dr. Tom Wong, the Chief Medical Officer for Indigenous Services Canada as well. Joining us via telecom will be Brenda Ristool from First Peoples Wellness Group and Carol Hopkins from the Thunderbird Partners Foundation, who will be looking at the mental health impacts. Obviously, we're wanting to show a united support and send love to all of those people who are looking after the health and wellness of our communities across Canada. This is to provide those folks with an opportunity to ask government officials directly questions and have them answered.
So mental health at this time when everyone is uncertain and fearful of the future, that's a big component of the discussion today, potentially. But in terms of things physical, I mean, we've already heard from the Assembly of First Nations, for example, and Perry Bellegarde declaring a state of emergency because of the reality, the geography of so many of the First Nations with whom you're going to be dealing today. They're remote, they're fly-in, there's no water, the housing is poor, hygiene is very difficult. How much more difficult does this create in terms of conditions for the coronavirus?
You know, this is impacting First Nation communities at a different pace than the rest of Canada. We have vulnerable populations with health disparities that are larger than the rest of Canada. And I think ensuring that we call upon government to send the necessary medical supplies and equipment to our communities that are required at this time, looking at food security as well at this pandemic time as well will be important. I think, you know, the segue that you played in with the song, we want to encourage all of our brothers and sisters from across Turtle Island to continue upholding our inherent knowledge by singing those ceremonial healing songs. Take pause and work on your regalia at this time so that we can show our resilience come this summer.
That's really interesting. Take a pause. You're essentially saying stay in, stay inside, as the message has been across the country. What is your understanding of on reserve in First Nations? Is there a willingness, an interest in social distancing and the things that we're all talking about, Marion?
Absolutely. We're wanting to ensure that we have culturally appropriate messages going to our front lines. It's hard to tell a group of folks who take gatherings so important. And that's why it's so relevant to get people gathered in this online town forum to mimic our community gatherings. We want to make sure that we're telling people to stand an arm's length away as opposed to the social distancing talk that we're hearing.
It's interesting that you say that gathering so important. We are hearing that some communities have put things like sweat lodges, the purification ceremonies, those are on hold. We're also hearing about some First Nations that have actually closed their borders to keep people out to ensure that coronavirus does not come in. What other things are you hearing in terms of measures that some of the communities have already taken independently?
Well, Heather, you make an excellent point. And of course, communities and nations are exercising sovereignty at this time. They are closing their borders to people who are not members of the community to further protect themselves. It's drastic measures like this that ensure the public safety of our nations across Canada.
Is there any other things? I mean, will there be recommendations to the people who are calling in, Marion, in terms of an answer to their questions or guidance on how they should be handling this? Make sure there's a unified message for all of those hundreds of people?
Absolutely. We want to ensure, first and foremost, that they have a united front of support. Indigenous Physicians Association of Canada, National Indigenous Nurses Association of Canada, Thunderbird Partnership Foundation, First Peoples Wellness Circle, the First Nation Information Governance Center, AFN, FNHMA, a lot of acronyms, but we all stand behind those workers and we'll do whatever we can to support them as a unified front. We obviously expect a lot of questions to come up from frontline, and we hope we can address those in the short time that we have.
Okay, unfortunately, we have a short time, but I do have two quick questions for you. When you say those workers, what we're hearing from healthcare workers across the country is they don't have the supplies that they need, and they're concerned about personal protective equipment, they're concerned about ventilators, they're concerned about gloves, those kinds of things, masks. Is there a sufficient supply for dealing with coronavirus cases in Canada's First Nations?
Well, imagine mainstream being concerned, magnify that concern in our communities. And those are exactly the questions we'll ask government officials.
Okay, and then finally, officially, as we look at the numbers every day, we're not getting anything as it points to within First Nations communities. Are you hearing anything anecdotally about First Nations, Indigenous communities dealing with coronavirus? Any cases so far?
Yes, well, we haven't seen that publicly broadcast. Our moccasin telegraphs are telling us there are instances of outbreak in some communities in Canada.
So you'll probably get a picture of that today as well. Well, we'll be continuing to follow that up. I think we're talking about how it is the elderly who are most vulnerable. We know how important the elders are within your community, so I'm sure a lot of interest in terms of keeping everybody safe and healthy, and we'll pay attention to that conference coming up today. What an interesting idea, the video online town hall. Thank you, Marion, for telling us about it today. I appreciate it.
Thanks, Heather, and thank you, Canada, for watching.
Marion Crowe from the First Nations Health Manager Association, she in Ottawa